I am not yet ready to declare the public health crisis over, but we do believe we see a light at the end of the tunnel.
The end is near when it comes to battling the public health crisis linked to Erie County's opioid fight. The county executive making that announcement yesterday. But today, addiction specialists are saying not so fast. Good evening once again. It was back in January of 2016 when Mark Poloncarz declared a public health crisis as Erie County faced an escalating opioid epidemic. Well, now, as the number of overdose deaths continues to drop, some believe that the county's mission will soon be accomplished. But is it too early to claim victory? Tonight, 7 Eyewitness News reporter Erie is live in our newsroom.
Well, that's right, Keith. An anti-addiction group tells me there's a lot of work that can be done. And while the death rates are down, the addiction problem itself is still remains.
It is possible that if we continue on this trend in 2020, the county executive would be declaring the public health crisis over.
A crisis Mark Poloncarz declared in January of 2016 after more than 300 people died of an opioid overdose in Erie County in 1 year. Last year, that number dropped to 191. So far this year, the county says 49 people have died. But setting a date to the end of the crisis has some advocates and experts concerned. Avi Israel is the president of Save the Michaels. He says we're actually in for a long fight.
I would caution everybody to slow down and let's take it easy because the rate of addiction is really skyrocketing here in Erie County.
Israel says the number of people in need of help can be overwhelming for a small organization like Save the Michaels.
We have, so far this year, have transported over 650 people.
He also worries the organization's source of funding would dry out as it relies on funding from Erie County. Poloncarz says more than 25,000 first responders and citizens were trained in using naloxone, the life-saving treatment to an overdose. Israel says he gives credit to the county executive and the Department of Health for helping out and taking the initiative. But he says there's more that can be done. For example, when someone returns from a treatment facility, there's not always housing for them.
We need to talk more about addiction as a legitimate disease.
Israel also says he believes there need to be more beds for women and pregnant women, as well as more education in schools and within the medical community. Live in the newsroom tonight, Erie, 7 Eyewitness News.